So I decided to become a nurse. So I did a 2-year degree and got my nursing degree. And that way I could actually work as a nurse as I was going to school, which was great because I was making money and going to school. And then when I became a pediatric nurse practitioner, there was the opportunity at Seattle Children's. So as a nurse practitioner, you'll probably see in the name, it'll say ARNP, which means Advanced Registered Nurse Practitioner. So that's what it means as nurse practitioner. There's lots of different nurse practitioners. So you can be a nurse practitioner that delivers babies, and that's called a midwife. Or you can be an adult nurse practitioner. You can be a like anesthesiology nurse practitioner and go and deal with surgeries and medicine. And you can be like a psychiatry nurse practitioner and help people with their mental illness and behaviors. So lots of different options, right? There's so much you can do. And I think as a nurse or a nurse practitioner, there's always options, which is great. So you can be a phone nurse practitioner, you can work in the hospital as a nurse practitioner, or you can work in a clinic. So I work in a clinic, even as a pediatric is specialized, right? Just in kids. But even in that, you can also have more specialized. So I work in the sleep clinic at Seattle Children's. So I'm able to talk to kids all day long about how they're sleeping. As a nurse practitioner, I'm able to actually see a patient, take their history, do a physical exam, and I can write orders. I can order medications, I can order labs or tests that they might need, which I really enjoy. And then they will go on, like my kids don't really like that I work in a sleep clinic because I'm always telling them to turn their devices off, get into bed, get your a little over 9 hours of sleep is what every teenager needs. And that sleep is so important, right? Because you grow, you learn, you remember things happen when you sleep. But I really just enjoy being a nurse practitioner. I love what I do. I love working with kids and the opportunities that it's given me. So I don't know if there's anything else you guys want to ask right now.
Well, there's a shout out to you right now. Hi, Amber. It's Evan, and I don't want to butcher his last name, Schwent.
Hi, Evan. I saw you. How are you? You look like you're in Hawaii.
So if anyone has any questions, go ahead and put it in the chat. We can start asking some questions and get some more information. There were some great questions in the last one, just kind of asking about, what a typical kind of work day was and that kind of stuff.
Yes, in the first session, so they asked me what's your best part of your job and kind of what's your worst part of your job. So I was telling them like the worst part is that I see a lot of things that are happening, right? And kids are sick and there's a lot of things they're going through in their family and in their medical life. So that's really hard because I want to fix everything. I want to help everything, but you can't do that. So I have to kind of realize that I'm going to help what I can and hopefully guide them to get the help they need in other ways. And then the best part of my day is working with kids and just talking to kids and really getting to know them and understanding them.
So the first question, they're coming in now. Okay, so the first question is from Carter. What do you like about your job?
Well, I love just being able to talk to kids, and I work in a clinic, so I see 10 kids in my day. So I could go and see like a 2-year-old toddler who's crazy all over the room. Well, before COVID, they were in the room. Now they're just at home. Or I can go and see a teenager who can't sleep at night, or I can go and see a child with special needs who maybe has cerebral palsy or can't talk or can't walk. So I just think it's a good variety. Like I can see everybody and then just getting a chance to know them and talk to them and help them is what I like the most.
So Alyssa asks, what type of things do you do in the hospital?
Well, I'm a nurse practitioner that works in clinic, right? So the people in the hospital, the nurse practitioners in the hospital are doing, they're doing probably on-call work. They might be working night shift. They might be working weekends. The hospital never shuts down. Clinic for me is nice because it's just during the day. I get to kind of assess and do things for them. I order a lot of sleep studies, and then the sleep studies get done at night, but I'm not there at night. I'm asleep. So the sleep studies happen at night, and then I'm ordering the sleep studies and ordering tests, and just see, I get to listen to their hearts and lungs and look in ears and, kind of assess everything that they need in my clinic.
So since you're not working at night, Emily asks, what hours do you work?
I do 4 10-hour shifts in a week. So technically it's a 40-hour work week, but I'm like more of a provider, right? I have to like answer questions that are urgent, or I have to sign orders. So there is some days where I don't get out exactly on time, or might work a little extra at home to finish charting. But it is technically a 40-hour a week.
So another question for Amber is, what inspires you to work with children? Good question.
I think I was an only child, and so I loved like being with other kids, and I loved just taking care of kids. When I was little, I would babysit. My mom was a nurse, and I would go into her office and play with paper dolls. And so I don't know, I just was a kid person, I guess. But I've always known that's something I like, and I'm happy to be where I'm at, where I can continue to do that.
We've got a couple of questions that are kind of similar coming up, and it really just kind of references kind of your education and background. How many years of schooling kind of did it take, or how many, kind of the process?
Yeah. So I think there's a few ways you can go about it, right? Because I was a nurse, and I got my 2-year degree and just became a nurse, and then I worked as a nurse, and then you have to get your bachelor's. So bachelor's is usually 4 hours. Or 4 years, sorry, to get your bachelor's. And then you do 2 more years to become a nurse practitioner. And currently in this state, you have to get your doctorate in that 2-year program. So it's about 6 years out of high school.
Carter says he wants to be a pediatric endocrinologist.
Oh yeah, and so if you're an endocrinologist, that's a doctor, right? So you're going to have to go to med school and do residency and do a fellowship, and those doctors work hard to get where they're at. And you can actually become a nurse practitioner. And at Children's, they have a huge endocrinology department where they have a lot of nurse practitioners and physician's assistants that are endocrine specialists. And of course, in other places in Washington, not just Seattle Children's, you can work. Yeah.
So anyone else have any questions? We've got time. We've got plenty. You can pick her brain, get all the details you want to know.
Someone asked me what my favorite part of nursing, or if I liked nursing school. And I was saying that it was really fun because we would practice giving shots on an orange. And then all of a sudden we had to practice on each other to give shots. So I'd always like go to the person I was mad at and be like, can I practice on you? It was fun. But yeah, and the nursing program was also, you have to do like different areas you have to work in. And so one of the areas is usually a nursing home. And a lot of people are like, oh, it's like you go into a nursing home, it's kind of sad. There's a lot of old people, but I really liked it because you could like sit and they would tell you like so many stories about their life. And you were just helping them, and you knew you were doing your part to like make their life a little better. So I think it's a good thing.
So someone asks, what was your first job you wanted?
My first job I wanted was what I'm doing now. Isn't it amazing? Like I just was like envisioning it. And every time I would drive over the bridge in Seattle, I'd see the University of Washington, and I'd be like, I'm going to go there, and I'm going to be a nurse practitioner, and I'm going to work with kids. And
so you knew that you wanted kids, you wanted ped right from the start.
Yeah. Oh, I've always been, loved kids. So it's been great. And I think if you really envision it and you want it, you can do it.
So another question comes in, can working with kids be stressful at times, or do you enjoy it all the time? Great question.
Yeah, I think it definitely is, right? Because there's, again, challenges that they're going through where they're stressed or they're sick, and it's really hard. Like you're trying to help them. Sometimes they can't, they don't even know how to help themselves, or they say they don't want help, and you're really trying to kind of do something to help. Or if something we order doesn't work or it comes back really bad, then we have to like talk to the kids about it. And then, so then if I leave and I come home and I've experienced these like really sad things or upsetting things, it can be challenging to kind of push that away. And that's why you have to like take care of yourself always, right? Because I can't be a good nurse practitioner if I'm not if I don't feel good and I'm not, so my family comes first and then my job for sure, but it's stressful.
Oxygen mask on first, right?
That's right.
So I'm gonna just rearrange the order of some of these questions because I think this kind of tacks onto that. Has a kid ever had a panic attack while you were helping them?
A lot of kids have anxiety with me. So if you're talking to them, they tend to kind of cover up, or they don't want to look at you, and so you could take that panic attack. I don't think I've experienced the panic attack like directly in front of me, but they'll tell me about their panic attack experiences or what's upsetting them. Um, but I think that's one thing I always look at. Like, I'm not going to be mad at a kid if they're, kind of upset or anxious. That's not their fault, right? If they're having a panic attack, we're going to deal with that first. We're not going to keep talking about what I want to talk about. Yeah, but panic attacks are really scary for a lot of kids. They tell me about them.
I think we've got another question about hours. So do you ever work at night?
So I'm lucky that I have a job where I have to see kids during the day. And then I order studies, though. The sleep studies are done at night from like 7 p.m. to 7 a.m. They have to go and spend the night, and they put all the wires and monitors all over. And we're looking at how they're breathing and how they're moving. There's sleep technicians, or they're polysomnography technicians or respiratory therapists. They work all night long, and they actually are monitoring the sleep studies that I order. But yeah, I don't actually work nights. But again, if you worked in an emergency room or hospital, you would probably have to work nights at some point.
So we have about 6 minutes left. If anyone else has any more questions, we can go ahead and keep asking them.
Mm-hmm.
Trying to think. I'll ask a question. Are you going into the office as much as you were then now, or are you doing kind of remote stuff, or how have things changed under COVID?
Yeah, so there's 5 nurse practitioners and 5 physicians that work in our sleep program. And so I would say majority of us were working at home, primarily just doing telehealth visits. I personally wanted to see patients if they were sick or needed to be assessed. I was going in and seeing them. Also, I would go into the clinic and like be in a clinic room and then just be on my Zoom in a clinic room, because it was easier for me, because I have 3 kids at home all on electronics. It's not easy for any of us. So I'm sorry for you guys, because I know it's a challenge.
Well, speaking of electronics, Emily asks if you monitor people that are going through an EEG.
So I, as a nurse working at Seattle Children's, I saw a lot of EEGs performed, and they have like, I don't even know how many wires or monitors they have, right? It's like 40 or something. And then they're looking at 52. They're looking at all the different areas of the brain, right? Like just a lot of the brain. But what we do in the sleep study, so I'm only looking at like 6 EEG, 6 little electrodes, and we're looking at stages of sleep. So when you fall asleep, we can see if you're in light sleep or deep sleep or dream sleep. Like, it's really interesting, right? You can see kind of what's happening. But that's the EEG that I'm familiar with, is on a sleep study. It's not a full EEG that would diagnose seizures.
Oh, we've got another one. Keep them coming. We still have a few more minutes. Did you ever have to work on someone with Kawasaki disease? I think you spelled it correctly.
Yeah, Kawasaki's is not that common, right? It's a little rare, and they have come through the sleep clinic program. Yep, because with the Kawasaki's, you have to monitor the heart, and there are other things you have to really be aware of with Kawasaki's. I think I took care of some patients in Children's with it. Because there's all these things that can go wrong in life. And it's so nice when you go to a place and they know exactly what you have and they can monitor it and treat it the way they need to.
Anyone else? Come on. I know you've got questions. I won't out you for your name. I won't use names anymore. That way, if you want to be anonymous. Oh, here we go. Actually,
yeah.
Yeah.
Yeah, it's crazy. Some of the illnesses that you can have that like stay with you too, that you have to keep monitoring. Like, it's not like if you just have one thing and it goes away. Some of those things you have to really keep monitoring, or it can do things to you that you have to live with in the future. It's hard. But kids, you kids are resilient though. I will say, I see so many kids that go through so many things and they keep going. So keep doing a good job, you guys. Right, Evan?
Do you work more hours than a doctor or about the same or less?
I think with any type of job you do, like as a nurse or a nurse practitioner or a doctor, you can choose. You can choose if you want to work a lot or a little. It's all in kind of what you want to do. In my program, I would say the nurse practitioners see a lot more kids. We see a lot more patients. We get to like talk to them and interact with them. And unfortunately, the physicians have to do research and they have to keep up on their medical things. So they might not see as many patients as us.
Okay, everyone, we've got 2 minutes left. I have one question. So if you want to get a question in, get it in. So do you have to give patients a lot of blood draws if they have Kawasaki?
Well, specifically with Kawasaki, that's more of a heart, that affects the heart more. So I don't know about that as much. We do a lot of blood draws. I do order a lot of blood draws for sleep. It's low iron. We worry about low iron. So all of you hopefully are taking your iron supplements. But I do order the blood draws. At Children's, they do a great job. They have special cream they put on that can numb it, and then they pull the blood out. And then we run blood levels on everything though, right? Like thyroid and yeah, red blood cells, white blood cells. But yeah, we do a lot of testing.
So we got 2 last questions. One, I'll just read them both and then maybe you can group them together. What types of procedures do you do and what is the hardest part of your job?
The procedures, I don't do a lot of procedures. So there are some like the dermatology nurse practitioners might like biopsy things, or the ear, nose, and throat people are like removing stuff from the ear, and like there's those kind of procedures. I order like a heart ultrasound, or I order a sleep study, so I'm not doing a lot of procedures in my clinic. I kind of just like the talking and the listening to a heart. That's good enough for me. But if you wanted to do procedures, there's a lot of opportunity for that. And the hardest part of my job?
Mm-hmm.
Right.
Yep.
Yeah, I think the most challenging is when I see a kid struggling, or I see a situation where like something's wrong with the family or the kid, and I can't do anything about it. It's really hard when I can't help enough. But again, I just do what I can, know that you're helping, and try to get them to where they need to go to get the help.
Well, Amber, thank you for helping everyone at Seattle Children's, and just during this wild time that we're in. And I think we don't have any more questions, so we'll end it on that.